Assalamualaikum and good morning to our beloved lecturers, Sir Al-Hafiz and our fellow friends. Today our group will present about amputation, dwarfism and list autres. Let's introduce our group members. My name is Nur Hidayah binti Muhammad Nur.
Assalamualaikum. My name is Muhammad Amirul Adri bin Muhammad Zuanan from SR 245 4B.
My name is Muhammad Faiz Aizat bin Muhammad.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Akmal Hakim bin Ahmad Kamal. I am from RSR 245 4B. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Nasruddin bin Muhammad Azmin from SR 245 4B.
My name is Muhammad Nasfar bin Saiful Beran from RSR 245 4B. The first slide is the amputation. The amputation can be defined as a surgical removal of all or a part of a limb or the extremity. It can be arms, leg, foot, hand, toe or a finger. The amputation occurs because of a poor circulation or the peripheral arterial disease, resulting the tissue begins to die and infection occurs. What causing the amputation is the severe injury which happened during the accident, and cancerous tumor in the bone or muscle of a limb, serious infection which often occur to the diabetes person which have a poor healing ability, and also the frostbite. Next is the symptom of the amputation. The symptom of amputation is a pain or numbness in the foot. This occurs because of the blood doesn't flow to the foot or the leg. Next is the slow or non-healing sores or wounds. This symptom often occurs to the diabetic person because they doesn't have a great healing ability, which resulting to the surgical removal of the part which have wounds or the sores. Next is gangrene. Gangrene is a blood flow, a large blood flow to the large area of a tissue is cut off, and it causing the tissue to break down and die. Lastly is the absence or the weakened pulse in the leg. As you can see in the slide, there is photo of the amputation.
Okay, now we move to type and classification of amputees. Actually, amputees divide to two parts, which is upper and lower limb. Now let's see at left picture. You can see that in amputees we had 15 type of amputees, which is 7 type at the upper limb and 8 type at the lower limb. At first, shoulder disarticulation or SD. This type is for people that lose their arm until their shoulder. Next is 4/4. 4/4 is people that lose their arm including their clavicle bone. Third is ED or elbow disarticulation. This type was included separation of the lower arm from the upper arm at the elbow joint. In this procedure, the radius and ulnar bone are separated from the humerus. They just remove the bone without cut the bone. Next is above elbow, or we can call AE. They need to cut the humerus bone so that they don't have elbow. Below elbow or BE, they still have elbow, but they need to cut radius and ulnar bone. Now we move to lower limb. First is hemipelvectomy. This type is people who don't have leg including their half of pelvic bone. Second is hip disarticulation. They remove their leg by removal from femur bone. How to remember the part of amputation? You need to see at the keyword. Disarticulation is remove the bone without cut. Transword is for cut the bone. Right picture is tell about classification of amputee in sport. We need to know that in sport we only have C class for amputees. At the picture, you can see the class of amputee: person, and I already put a few example of sport that categorized by Paralympic Committee.
Okay, first is amputation. She have 3 points, which is peripheral vascular disease, pain lifestyle adjustment, and post-trauma. I will go first on peripheral vascular disease. Peripheral vascular disease, or known as PVD, is a circulatory ailment that develops over time. PVD is caused by a blood vessel narrowing, obstruction, or spasms outside of the heart. PVD, or peripheral vascular disease, can damage any blood artery, including the arteries, veins, and lymphatic vessel. The leg and feet, on the other hand, are the most usually afflicted. Symptom of PVD, which is how you can get it, which is change in the skin, including decreased skin temperature, or thin, brittle, shiny skin on the leg and feet. Second is weak pulse in the leg and the feet. Third point is numbness, weakness, or heaviness in muscle. That's for PVD. For next point is pain lifestyle adjustment, which is the point that I get is phantom sensation. A phantom sensation is a sensation felt in a limb that has been removed. Even after surgery, some patients believe their limb is still there. This is very normal. Feeling or sensation throughout the entire limb or section of the limb are possible. You may feel pin and needles and itch or tingling feeling. Following an amputation, many people experience phantom sensation, and the brain may have formed a record image of the limb. According to one explanation, as a result, when normal limb communications are missing, the brain tries to recreate a picture of the limb and transmit messages, resulting in phantom sensation. The third point is post-trauma, which is post-traumatic stress disorder or disease. It is a type of anxiety disorder marked by psychiatric symptoms that persist long after a traumatic event has occurred. Following battle, accidental injuries, burn and suicide attempt, and last amputees tend to be more likely to develop PTSD. The psychological effect of amputation appear to be heavily influenced by one's look. When a leg is severed, body image described as the individual psychological idea of himself is altered. Following amputation, a range of body image related issues, including as anxiety and sexual impairment or dysfunction, are the common problem of the post-trauma.
Okay, now I proceed to the coaching consideration for the amputation athletes. Okay, basically it was just a small changes in the amputates athletes training. This is because person with amputees, especially with legs prosthesis, they can do all the box jumps, plyometrics, and also everything that everybody else does. Okay, but the most important thing is what we must understand is about how long they have been in the amputee, because that residual limb has to get to in time. Yeah. Okay, the first point is be aware with the skin breakdown or pressure. Okay, I tell like that because we must know of how the prosthetics fits, which is we have to make a placement workout plan, and then we have to back off the training, and there must be a lot of communication between us, we as the athletes and also we as the coaches and also the athletes. Okay, the second point is we can say that sometimes another limitation was rain and sweat, which is the rain and sweat can cause the loss of prosthetics. So we must ask the athletes to use the different ply socks to keep and to make sure that the prosthetics was always on. The third one is be aware the falling. Okay, be aware of falling. Falling is common, and it was a part of process, and basically we can often see it with those who are above the knee amputees. Okay, because they will fall more due to their balance, and they must and the most important is we must make sure that the athlete should wear about 1 to 1.5 inches taller than their prosthetics due to the compression of the prosthetics itself. The last point is use an object to rest their residual limb, especially for the arm amputees. Okay, an object that can be used was such as a can or also a wooden box. This is because we want to ensure that the arms and shoulder was in the same level.
Assalamualaikum. Okay, so as you can see in my slide, I'll be talking on the treatment and prevention for amputation. So my first point is the compression garments. You'll notice swelling of your stump after surgery. This is normal and it may continue after you've been discharged. So using a compression garment will help with swelling and the shape of the stump. It may also reduce phantom pain and help support the limb. You'll be fitted with a compression garment once your wound has healed. It should be worn every day but taken off at bedtime. You should be given at least 2 garments, which should be washed regularly. So the next point is the rehabilitation. Physical rehab is an important part of the recovery process. It can be a long, difficult and frustrating process, but it's important to persevere. So after a rehab, you should be able to return to works and other activities. Your rehab program will be tailored to your individual needs and requirements, and will aim to allow you to carry out as many of your normal activities as possible. You'll work closely with a physiotherapist who will discuss with you what you like to achieve from the rehab so that some goals can be set. Moving on to the third point is the prosthetics. So after an amputation, you may be able to have a prosthetic limb fitted. Prosthetic limbs aren't suitable for everyone who's had an amputation because an extensive course of physiotherapy and rehab is required. So adjusting to life with a prosthetic limb takes a considerable amount of energy because you have to compensate for the loss of muscle and bone in the amputated limb. This is why frail people or those with a serious health condition such as heart disease may not be suitable for a prosthetic limb. But if you're able to have a prosthetic limb, the type of limb that's recommended for you will depend on the type of amputation you had, the amount of muscle strength in the remaining section of the limb, and your general state of health. So that is all.
So we move to the athlete icon for amputation. His name is Suraj Selvatambi. He is a Malaysian archer who has gained attention since being crowned champion at the 2019 World Archery Championship in the Netherlands. His victory carved an important moment in the history of Malaysian archery as he was the first Malaysian to win a gold medal in the tournament. After surviving a lorry accident at the age of 30, he had to rely on the use of prosthetic leg. He worked hard while juggling his archery training to feed his mother and younger brother, as well overcoming criticism from others who call him useless to his family because of his dream of becoming an archer. Nonetheless, the whole title has ensured him a place to compete in the previous Paralympic in the double 3-man individual recurve event standing amputation. He intended to win a medal in the event as well so he can dedicate it to his newborn son, whom he has yet to meet in person due to various quarantine and training bubble SOP. Move to the next presenter.
The dwarfism. Definition for the dwarfism. Dwarfism can be defined as the short stature that results from a genetic of a medical condition. It also can be defined as an adult height of 4 feet 10 inches, which is similar to the 147 centimeters or less. Average height for the dwarfism is 4 feet, which is 122 centimeters. The cause of the dwarfism, they have two type of dwarfism, which is disproportionate dwarfism and proportionate dwarfism. For the disproportionate dwarfism is inhibit the development of bone, which is more to the genetic problem. For the proportionate dwarfism is present at a birth or apparent in early childhood, limit overall growth and development, which is happen when the growth process. Symptom of dwarfism is first disproportionately short arm and the legs, which is happen during the growth development, and a large head, which is often occur during the growth development or during the birth. Next is a shortened feet and hands, which is occur during the growth development also, and a flat mid face during the birth and growth development. As you can see in the slide, this is the example of a dwarfism athlete.
Okay, now let's move to type of dwarfism. In dwarfism, we have two types, which is disproportionate and proportionate dwarfism. Disproportionate dwarfism is dwarfism that we can know after birth. They had this genetic problem from they were children or baby. If their parent is dwarfism or one of them is dwarfism, their children will inherit that genetic from them. Next, proportionate dwarfism is dwarfism that involve growth hormone deficiency. Those with this genetic will experience stunted growth. There are over 200 different types of dwarfism in world, but I will explain a few types, which is common type of dwarfism. First, achondroplasia is a disorder of bone growth that prevent the changing of cartilage to bone. It is categorized by dwarfism, limited range of motion at the elbow, largest head size, small finger, normal IQ, shortening of the limb, bowed leg and finger held in 3 groups. Okay, next is ACD. ACD is inherited bone growth disorder. You can identify this type by their skeletal abnormalities and problem with vision and hearing. This condition affect the bone of the spine and the end of long bone in the arm and leg. Next, dystrophic dysplasia is a cartilage and bone growth condition that cause discomfort and deformities in the joint. Symptom of dystrophic dysplasia dwarfism is shortening of the limb, foot deformities and hernia. After that, we can identify chondroplasia by disproportionate short stature, normal facial feature and head size, and early onset osteoarthritis. Intelligence is normal. They also had marked laxity in the finger, wrist, elbow and knee, which is joint. Lastly, osteogenesis imperfecta. Person have soft bone that easy to break and bone that are not formed normally.
Second one is dwarfism. That point I get is achondroplasia. Achondroplasia is a congenital condition that impairs the development of baby bones. Birth defects are medical disorder that exist at the time of birth. Birth defect alter the appearance of function of one more bodily component. They can have an impact on one general health how the body grows and how the body function. If a newborn develops achondroplasia, cartilage in the arm and legs does not develop properly and does not transform into bone. Achondroplasia is a kind of dwarfism that affects many people. I will tell you how they get achondroplasia. A person with achondroplasia often has short height, short upper arm and thigh, large head and forehead with a flat bridge of the nose, and lastly bowed leg. And you know how it occurs? Okay, I'll tell. Achondroplasia is caused by gene alteration, which is genetic mutation. Parents pass on their genes to their children. This alteration has the potential to cause birth abnormalities and other health problems. The majority of achondroplasia kids are born to parents who does not have the disease. This occurs when a random gene alteration occurs in either the egg or the sperm that combine to form a kid. Achondroplasia can be passed down to your child if you or your partner have it. If just one of you has the disease, your kid has 1 in 2 risk, which is 50% of getting the achondroplasia.
Okay, now proceed to the coaching consideration for the dwarf person. Okay, basically there are over 200 types of restrict growth that can be grouped as a dwarf condition, and the most common one is achondroplasia. Okay, for the first point is Dwarf Sport Association UK. Okay, Dwarf Sport Association UK is the leading organization for sport, especially for people with dwarf condition. Sorry. Okay, the second one is perform regular physical education and sport activities. I tell like that because dwarf person must perform a regular sport activities, because regular exercise can make a big difference to the lifestyle and well-being of the person with dwarf condition. Okay, the third one is tend to be overweight and have to reduce range of motion and joint defect. Okay, in this point we have to focus on the range of motion and the joint defects. This is because people with achondroplasia especially have a liposis, or known as scoliosis, at their spine, which is a constant shock can cause a damage to their spine area. Okay, for the fourth one is we have to avoid or modify activities that place undue stress on weight-bearing joints. Okay, in this point we can see that we have to keeping the weight off and have a regular exercise can prevent or delay the need for invasive surgery to stabilize back and joints problem.
Okay, so for the next slide, we'll be talking on the treatment and prevention for dwarfism. So the goal of the treatment is to maximize functioning and independence. Most dwarfism treatments don't increase stature but may correct or relieve problems caused by complications. So for the first point, surgical treatments. Surgical procedures that may correct problems in people with disproportionate dwarfism includes correcting the direction in which bones are growing, stabilizing and correcting the shape of the spine, and also increasing the size of the opening in bones of the spine to alleviate pressure on the spinal cord. Moving on to the second point is the hormone therapy. For individuals with dwarfism due to growth hormone deficiency, treatment with injections of a synthetic version of the hormone may increase final height. In most cases, children receive daily injections for several years until they reach a maximum adult height, often within the average adult range for their family. Treatment may also continue throughout the teen years and early adulthood to ensure adult maturation, such as appropriate gain in muscle or fat. Some individuals may need lifelong therapy, and the treatment may be supplemented with other related hormones if they are also deficient. For the third point is the ongoing healthcare. Regular checkups and ongoing care by a doctor familiar with dwarfism can improve quality of life. Because of the range of symptoms and complications, treatments are tailored to address problems as they occur, such as assessment and treatment for ear infections, spinal stenosis, and sleep apnea. Adults with dwarfism should continue to be monitored and treated for problems that occur throughout life. And the last point is the limb lengthening. So some people with dwarfism choose to undergo surgery called extended limb lengthening. This procedure is controversial for many people with dwarfism because, as with all surgeries, there are risks. Waiting to decide limb lengthening until the person with dwarfism is old enough to participate in this decision is recommended because of the emotional and physical stress involved with multiple procedures. That is all.
Next athlete icon for dwarfism is Bonnie Buyao Gusting. He has been training hard under the guidance of his father, a former para-weightlifter, since he was a child. He now hopes to become a Paralympic champion and make his father proud. Before qualifying for the Tokyo 2020 Paralympic, Gustin was crowned champion at the 2019 Para Powerlifting World Cup in the men's 65 kilo category. At the Para 2020 Weightlifting World Cup, where he competed in the over 72 kilo category, he managed to win another gold in that category and broke the world weightlifting record. His amazing performance has garnered national recognition, and the Argonne also come forward to congratulate him. Next.
Definition of the les autres. Les autres came from the French word which means the others. It can be described as an athlete with range of a condition which result in the locomotive disorder that do not fit in the traditional classification system of the established disability group. In the simple word, is a les autres is an athlete which have a multiple disability problems. As you can see in the slide, dwarfism, multiple sclerosis, and other disabilities is the classification of the les autres. As you can see in the slide, this is a photo of the athlete who have got an amputation and also got a problem in the locomotive disorder.
Okay, now is classification for les autres. Les autres is classified by a group that been established by the committee. As you can see on the slide, there's some example of sport that had been contested for the les autres athlete. For archery, the athlete will compete together with several palsy and amputee athletes. Cycling divided by 4 categories, which is LC1 to LC4. Next is athletic categorized by using code F or T41 to 46. Another sport for les autres athletes are powerlifting, sailing, shooting, and volleyball.
Okay, the last one is les autres. Les autres same like the amputation and dwarfism, but the only different in les autres, they have locomotive disorder that doesn't fit into the traditional classification system of the established disability group. That's all that I know from les autres.
Okay, the next one is coaching consideration for the les autres person. Les autres is a people with locomotor disabilities. Okay, for the first point is weak muscles are typical. Okay, in this point we must understand that weak muscles for the les autres person was typical. So we must always communicate. We as a coach must always communicate with the athletes and get an incentive, such as consider an alternative position and support to allow the athletes to rest and perform a specific stretch or exercise safely. because of their balance and coordination problem. Okay. The second point is maintain or increase muscular strength and endurance based on their ability. Okay, the third one is avoid performing beyond 50% of maximum resistance of weight training. Resistance of weight training. This is especially for the individuals with muscle disorders. Okay, the last one is do a proper warm-up activity. They must do a proper warm-up activities, especially for the person with arthrogryposis and the others with joint limitation. Yeah.
Okay, so for the third slide of the treatment and prevention, I'll be talking on the less autres. So as you all know, less autres is a sport classification which is used in disability sport for people with locomotor disabilities. So there are a few examples that I have provided in my slide. So the first one is the difference in limb length. So the treatment, for example, the lower limb discrepancy, which is leg, the treatment is by wearing a shoe leaf. So doctors may suggest a leaf fitted to the inside or outside of the shoe to see if it improves a person's ability to walk and run. A shoe leaf may also help with back pain caused by a smaller lower limb length discrepancy, and shoe leaves are inexpensive and can be removed easily if they are not effective. So the next point, Guillain-Barré syndrome. So what is Guillain-Barré syndrome or GBS? So GBS is a rare autoimmune disorder in which a person's own immune system damages the nerves, causing muscle weakness and sometimes paralysis. GBS can cause symptoms that last for a few weeks to several years. Most people fully recover, but some have permanent nerve damage. And in some cases, some people have also died because of GBS. So the treatment for the GBS is intravenous immunoglobulin, which is IVIG. The most commonly used treatment for the syndrome is the IVIG. And when you have this syndrome, the immune system, which is the body natural defense, produces harmful antibodies that attack the nerves. So the IVIG acts as a treatment that is made from donated blood that contains healthy antibodies. These are given to help stop the harmful antibodies damaging your nerves. So the IVIG is given directly into your vein. So my third point is on the Ehlers-Danlos syndrome. So the Ehlers-Danlos syndromes is a group of inherited disorders that affect your connective tissues, primarily your skin, joints, and blood vessel walls. Connective tissues is a complex mixture of proteins and other substances that provide strength and elasticity to the underlying structures in your body. So people who have this syndrome usually have overly flexible joints and stretchy, fragile skin, and this can become a problem if you have a wound that requires stitches, because the skin often isn't strong enough to hold the stitches together. So for the treatment for this syndrome is physical therapy. So joints with weak connective tissues are more likely to dislocate. Exercises to strengthen the muscles and stabilize joints are the primary treatment for this syndrome. Your physical therapist might also recommend specific braces to help prevent joint dislocations. So that is all. Thank you.
Last icon for Les Autres is Arnaud Petracek. He is a scissors Paralympic swimmer who competes in the international event Rio 2090. Paralympic champion Arnaud Petracek has been voted this year Scissor Republic athlete. The swimmer took home his country's lone gold medal from Rio 2016 after his victory in the men's S4 backstroke 15-meter event. It happened after he showed a performance with silver at the 2016 Europe Championship in Funchal, Portugal.
Okay, next we move to the safety consideration. First, you need to consult with the doctor before starting any exercise program. Consult with your doctor if you are considering starting an exercise program for the very first time. If you experience any adverse consequences, always check whether any of your medication could have an effect on exercise tolerance. For example, regulating your body temperature or the effect of your medication on blood pressure. The second one is stop immediately if you start feel pain. Stop exercising if you experience pain, discomfort, nausea, dizziness, like headaches, chest pain, or shortness of breath. The third one is don't exercise if you are feeling unwell. For example, if you are suffering from a cold, flu, bladder infection, pressure ulcer, or unusual spasticity, exercise may worsen your symptoms and will not result in a quality exercise session. Next is spacing of daily activity or rest period during the day may be necessary for the initial stage. Spacing of daily activity or rest period during the day may be necessary during the initial stage. It can help to reduce fatigue. It can be useful to record our daily physical activity and exercise to help you determine an appropriate intensity and duration. And the last one is if you go to the local gym, ask for induction. If you choose to go to the local gym, ask for an induction if you are not offered one, so that you can become familiar with the equipment and also the environment at the gym. Okay, next we will move to the consideration for individual with dwarfism. First point is do the isometric exercise. Isometric exercise such as plank, where you hold your body in one position. These exercises are useful to strengthen the muscle around your joint. The second one is always do the exercise that involve smoother movement rather than explosive movement. Exercise that involve smoother movement are better than those that involve a lot of jumping and also explosive movement. It can impact on your joint. Care should therefore be taken to avoid impact activities such as trampolining and also gymnastics. The third one is try a swimming exercise. It can help to reduce the strain and impact that is placed on your joint during many other traditional forms of exercise, but still provide a great aerobic workout. Next, we move to the amputation. First, perform regular wheelchair push-up to relieve pressure. Pressure areas may be prone to ulceration, so you need to check your skin and reposition yourself regularly. Perform regular wheelchair push-up to relieve pressure. You could set a reminder to do this every 15 to 30 minutes. Last one is you may be at risk for osteoporosis if you do not engage in enough weight-bearing activity. If your level of weight-bearing activity is low, you may be susceptible to osteoporosis. Taking part in physical activity will help to prevent this. However, if the bones of your legs become weak, this increases your risk of a fracture if you fall. Hence, your safety and stability during an exercise is very, very important.
Finally, the conclusion for amputation is lower limb amputation is a major disability involving functional and professional disability. We can reduce the risk of the disability with good and appropriate rehabilitation. Dwarfism occurs when a person is very short. Medically, a person is considered dwarf when they have a condition that causes them to be very short. But society may consider a person a dwarf based on short stature alone. In the Paralympic, less autres is abbreviated to ALA abbreviation for amputee and less autres because the two disability category compete in the same event. That's all from us. Thank you.